purpose of termination. The purpose of termination is to save the life of the mother, to preserve the physical health of the mother, to preserve the mental health of the mother. In cases of rape and incest, when the unborn child has medical problem or the birth defect, for social and or economic reasons such as if the mother cannot afford to support the child and available on demand, no reason need to be given. Abortion can be diagnosed during visual examination of blood loss, ultrasound scan, dilatation and curettage, evacuation of the fetal part under general anesthesia. The management for patients with abortion consists of assessment. Assessment can be done during interview to collect the data. The important data include about gynecology of patients such as last menstrual periods and menarche, problem with the past gynae such as fibroid or abortion, experiencing problem with the reproductive system such as salpingitis. Other than that, the data will be collected regarding the sexual history, history of contraception such as uses of IUCD, history of obstetric where the patient ever experiencing problem during pregnancy and method of birth, and medical history regarding experiencing medical problems such as diabetes mellitus. After data collection, the physical examination will be performed, which is include of observation on vital signs to detect bleeding and infection, breast examination, abdominal examination such as to check for the uterine size, fetal movement and fetal heartbeat. Another physical examination includes vaginal examination such as vaginal bleeding and opening of os. There are a few investigations will be performed to confirm the diagnosis of abortion, which is urine examination such as urine pregnancy test, hemoglobin total white differential count, group and cross matching, serum or urine for human chorionic gonadotropin, and ultrasound. Now let's see the management of threatened abortion. Patient with threatened abortion will advised to rest completely, and then patient will be monitored for the maternal and fetal progress such as observation, monitor bleeding through the vagina through the chart pad such as for volume, nature and color, and if continued bleeding occur, patient is prepared for the dilatation and curettage. Another management will include monitoring of vital signs to detect the sign of bleeding, such as pulse, tachycardia followed by bradycardia, blood pressure begins to drop, heart rate tachy then brady, to detect sign of infection, body temperature rises, heart rate of patient will be tachycardia, patient complain of backaches and pain in the lower abdominal, and we will maintain perfusion and continue for the intravenous infusion and preparation for the blood transfusion if necessary. Further care for the threatened abortion is include nutrition. Patient will be given high protein foods such as chicken, fish, legumes and so on to aid healing, food high in calcium to help in the regeneration of red blood cells, and food high in vitamins such as vegetable and fruit to speed healing. Patient also will advise to rest completely, avoid lifting heavy objects, avoid constipation such as taking high fiber diets and drink excess water about 1,500 ml per day. Then, patient will treat with hormone therapy. Maybe doctor ordered the administration of drugs such as Proluton, depot 135 mg daily if progesterone level decrease, and Dufaston 20 mg daily to maintain estrogen level. Other than that, the management include to avoid infection for the patient. Patient will advise to change the pad when wet, maintain aseptic technique during vaginal examination and vulva swabbing. The last one is patient is giving emotional support such as always listen to the patient complaint, help patient with daily activities, encourage husband or family to accompany the patient, and consult a doctor if necessary if patient having a problem. And most important is patient will advise to not having a sexual intercourse for at least 2 weeks after the abortion. For the complete abortion, under inevitable abortion, the management for complete abortion include patient will put on complete rest in bed and observation and put under peg chart and monitor for the vital sign. For the incomplete abortion, patient will put under complete rest in bed, observation peg chart, 10 unit IV oxytocin drug for product of conception production, preparation for the dilatation and curettage. The management of missed abortion, patient will give TCA and screening after 2 to 4 weeks if missed abortion is found. The uterus will empty immediately after decreased fibrinogen level or patient is having anemia or infection. Then labor induction if pregnancy more than 12 weeks, IV oxytocin or prostaglandin to initiate contraction. DNC if less than 12 weeks of pregnancy, and if hypofibrogenemia, patient will give IV fibrinogen is given. Possible hysterectomy is done if failed to empty the uterus 2 to 3 months later, and IV antibiotics such as Flagyl and IV ampicillin will give to the patient. For the silent miscarriage, patient which is failure to expel the product of conception following the fetal death, recognized by failure of pregnancy to develop or expected uterine size for gestation, may pass small amount of blood vaginally, dark red or brown in color. Pregnancy symptom usually cease. So examination will done to check for uterine size if not corresponding to the period of amenorrhea. Os is closed with the minimal blood may be seen. Ultrasound will done to the patients to look for the fetal hole which is more than 6 mm, no fetal heart if less than 6 mm, and no change on the wrist scan after the 7 days. For the habitual abortions, doctor will check for the hormonal studies such as HCG, blood for HCG and progesterone level. Another one is a blood study for the VDRL, group and cross-match, RH factor, torches, thyroid function, and serum folate. Hysterosalpingogram is performed during pregnancy and the effect of congenital malformation of the uterus, internal competence os. The treatment for abortion will be divided into two, which is